Good afternoon. Welcome back. So good to see you. Committed people for the high-level commitments. Clean air for all, time to commit and act. Our call to action for our high-level commitments comes via the Global Climate and Health Alliance, Latin America. Take a look at the screen, and this is why we're all here. Let's take a look. The tension, the excitement, the anxiety of the backstage crew. I'm moving on because we have a lot to pack into this session. I'm going to call to the stage Heather Adair Rouhani from the WHO. Heather, hello, welcome. We don't need a video when we've got Heather.
Thank you. Good afternoon. It's the time to make commitments to taking actions towards achieving the 50% target to reduce health impacts by 2040. Now, this is an ambitious target, but it's an important target. It's really critical to make sure that we actually achieve the clean air we want for public health protection, to reduce climate change, and ensure proper and sustainable development, as well as economic benefits. So I'm really looking forward to asking you all, every person that can, to make commitments towards taking steps towards achieving that 50% reduction in health impacts from air pollution by 2040. So I'm really looking forward to hearing all of these commitments, because we really have to work together, because air pollution is a collective problem for collective action. So let's take action together. Thank you.
So you see these white chairs back here. This is my commitments waiting room. I'm going to ask to come to the stage to sit in the waiting room, ready to leap to the lectern to do their 1-minute commitment. The United Kingdom, please come and take a seat. London Deputy Mayor, on behalf of the co-chairs of C40 cities, come and take a chair. Hello, Brazil, come take a chair. Spain, hola, Spain, take a chair, take a seat, come up and sit. You'll notice I'm doing countries and organizations, not actual names. So several people could come up, but I only need one. And hello, China, please come and take a chair. Excellent. I know we're anticipating so much in the way of commitments. Do not let me down, waiting room. All right. We start with Lina Yanina Estrada, Minister of Environment and Sustainable Development in Colombia. Minister, it's good to have you. Are you coming down? Great. Your timing is impeccable. Amazing. Minister, hello. Please come down. The clock has already started, Minister. We've now got 4 minutes on the clock for you. Welcome. It's so good to have you to kick off our high-level commitments. Take your time, don't trip. Because we need to get the commitments first. Then you can trip. Hello, Minister. Welcome. Thank you so much. Good to see you. Oh, yeah. Yeah, aquí. Gracias.
Thank you. Thank you. Buenas tardes a todos.
Good afternoon, everybody. Thank you so much for having been with us during this dialogue time today, and to the organizing committee. I want to thank Maria Neira, the director of the Environmental Department, Climate Change and Healthcare from the WHO. Mrs. Gina Tambini Gomez, the representative from PAHO and WHO here in Colombia. To our moderator during this space, thank you to Femioake. and to all the representatives from the governments, international organizations, and experts in health and environment from the 75 countries represented here. To the academic community from Cartagena, ladies and gentlemen, media, we are going to begin with the reading of the commitments we have here in Colombia in regards to air contamination, which of course demands a high commitment of a high level from several stakeholders and sectors, considering the need to reduce the impact generated to health and financial effect that implies the treatment of respiratory diseases. The second global conference on air pollution and health represents an opportunity which is key to strengthen here in Colombia the intersectorial performance, also domestic and territorial, to be able to implement actions that will reduce the effects of air pollution in health and that can contribute to reaching sustainable development objectives in such a way that Colombia reaffirms its commitment in the progressive improvement of air quality, which will have positive effect in health, the environment, and quality of life of the population. That's why we commit as a country to first to join efforts from the various sectors and stakeholders in order to work with actions intended to reduce air pollution, mainly those such actions of surveillance in public health to allow the mitigation of the impact in this phenomenon that this phenomena will bring. Also to foster actions that would strengthen impact analysis in health due to external and internal air pollution, both internationally and in the territory, and its economic assessment. Third, we are going to promote energy transition, one that is fair through the use of clean technologies in the various sectors, such as the industry and transportation, thus guaranteeing the high quality standards that will allow to reduce impact in the environment and in health. Fourth, we will generate early warning systems for the prevention and mitigation of wildfires, considering their incidence in air pollution and their effect in public health. Fifth, we are going to foster scenarios as it is the interest of the national government to establish mechanisms to compensate the external debt in countries due to the execution of climate actions. Thank you very much.
Thank you so much.
Thank you. Appreciate you. Please. Muchas gracias. All right, this is a tough one. Not only are you committing, but you have 1 minute to do so. The UK, I know you're up to the challenge. Good afternoon.
Thanks, Femi. Thanks, everyone. So the UK would like to congratulate WHO and the government of Colombia and the city of Cartagena for hosting us. It's been fantastic. So just a few things. So the UK has long been a leader in tackling air pollution, and we've heard since back to the Clean Air Act of 1956. So we continue to lead that. We'll continue to co-chair the Forum for International Cooperation on Air Pollution, together with the government of Sweden, and we support the Climate and Clean Air Coalition's Air Quality Management Exchange platform. Domestically, we made significant progress. We've set health-based targets to reduce people's exposure to concentrations of fine particulate matter the most harmful pollutant. And we've set an innovative exposure reduction target for PM 2.5 and an ambitious concentration target on which we're making good progress. This summer, we will set out new measures to improve air quality in our environmental improvement plan, reducing the emissions of pollution even further to protect and improve everyone's health. We will also drive long-term change through a new air quality strategy, looking afresh at our targets to continue raising standards and driving down pollution, boosting local democracy, giving communities a real say over how the air where they live is improved, improving the way we communicate, informing people, especially vulnerable groups, about pollution levels and how to protect themselves. We will continue to reduce emissions to set a path towards halving the health impacts of air pollution by 2040 and continuing to work towards achieving the WHO's air quality guideline levels across the UK. Our strong commitment to tackling air pollution internationally is the reason why the UK has taken on, just this year, has taken on the co-chair role of the Climate and Clean Air Coalition together with the government of Brazil. And today I can announce a further £700,000 of UK funding to the CCAC for the development of the Africa Clean Air Programme, which we heard a bit about this week, a landmark initiative which will serve as a vital platform for regional cooperation. Chair, that the UK stands fully behind the WHO in its efforts to tackle air pollution and is strongly supportive of action towards the global target of reducing the health impacts of air pollution by 50% by 2040. Thank you.
What's that? Leave the stage. London Deputy Mayor, on behalf of the co-chairs of C40 cities, the microphone is yours, and when you finish your commitment, please exit off the stage this way, to applause, of course.
Thank you very much, Femi. Your Excellencies, distinguished delegates, esteemed colleagues, as mayors of London and Freetown and co-chairs of C40 cities, we represent the world's largest cities on the front line of the air pollution and climate crisis. C40 cities is a network of nearly 100 world-leading cities working together to take urgent action on the climate emergency and improve air quality for over 650 million people. We're committed to addressing the air pollution crisis, which claims over 8 million lives annually and disproportionately affects the most vulnerable. We welcome the World Health Organization's updated roadmap to address air pollution health impacts, targeting a 50% reduction in pollution-related deaths by 2040. Achieving this will save millions of lives, reduce healthcare burdens, and improve urban livability. Our cities are proving that evidence-based action delivers results. Through C40's Clean Air Accelerator, 50 cities have set ambitious targets, implemented bold policies, and reported annual progress since 2019. And our latest report highlights that cities prioritizing clean air policies, expanding zero-emission transport, establishing clean air zones, supporting active mobility, and improving waste management. Our flagship initiative, Breathe Cities, in partnerships with C40, the Clean Air Fund, and Bloomberg Philanthropies, is working with 14 cities to cut air pollution and emissions by 30% by 2030. And cities are already leading the way across the world. London's Clean Air Zone has cut nitrogen dioxide by over 50% in central London and 25% in outer London. Warsaw reduced PM 2.5 levels by 33% between 2017 and 2023 through cleaner heating practices. And Bogota is deploying 100% bus fleet, improving air quality for 35,000 residents while promoting gender inclusion in transit jobs. Breathing clean air is a fundamental human right. Air pollution is a public health emergency and a matter of justice. Marginalized communities, children, older adults, and outdoor workers bear the brunt of toxic air, worsening health disparities and straining public health systems. Prioritizing clean air policies protect those most at risk and creates healthier, fairer cities. However, we recognise that cities cannot do this alone. So therefore, we urge national governments to act now by scaling up financial support, strengthening air quality monitoring, and enhancing city-national collaboration. We welcome the health sector's role in making the economic case for clean air, as benefits will be first felt by patients and in healthcare savings. Through the C40 Clean Air Accelerator and Breathe Cities, we will continue aligning city-led action with the WHO air quality guidelines and urge more cities to join us. Cities are stepping up to tackle toxic air pollution, and we invite more to join this fight. We're committed to working with national governments and global institutions to build healthier, fairer, and more livable cities for all. Clean air is not a privilege, it is a fundamental right. Together, we can make this vision a reality. Thank you.
Thank you very much. Good afternoon, Brazil. The lectern awaits for you. Thank you.
Muchas gracias.
Thanks a lot from the Ministry of Health in Spain and a perspective of the environment of healthcare. We wanted to point at 5 commitments, particularly one to continue maintaining air quality standards aligned with the WHO guidelines that will be represented in the implementation of the Air Quality Directive recently approved by the UN. And the second element, to invest in a suitable and sufficient manner in the development of information systems that are pertaining to those elements related to healthcare and environmental terms. And that's why we are developing and continue developing surveillance systems of environmental health. The third element is the routine gathering of data that has to do with healthcare risks that entail environmental contamination and pollution, and its stratification to bring this data to the actual reality of the patients. And the fourth element is to contain and to continue with the mechanisms of intersectoral work at various levels between the various and relevant ministries in these matters that are not only the Ministry of Health and Ecological Transition, but all those ministries impacted by it. And the last element, which has to do with the reduction of GHG emissions, particularly affecting healthcare. And in that respect, we are committed to continue so that by 2050, we have a public healthcare system that is neutral in terms of emissions at a global level. So that will be all. Thank you very much.
Welcome, Spain. Spain. Is Spain here? Oh, Spain. Oh, sorry. We can't have Spain again. China. That would be a double commitment. Spain is like, we're not going to double our commitment. Welcome, China.
Thank you. China thanks the WHO and the Colombia government for organizing this important conference. We've made great progress in reducing air pollution and protecting public health. As a big and responsible nation, China supports WHO's clean air efforts and is taking actions through the Healthy China, Beautiful China, and dual carbon strategies. This includes stronger air quality standards, smarter health protection systems, and international cooperation. We will keep working toward our national goals for 2030, 2050, and 2060, and are also ready to share our clean air experience with the world to help build a better future for all. Thank you.
Good afternoon, Brazil. This feels like a sporting ceremony. It's like the Olympics.
Okay.
For some major competition.
It's a continuity.
To make the world better.
Good afternoon. The Brazilian Ministry of Environmental and Climate Change and Ministry of Health highlight the importance and success of strengthening interministerial cooperation during the second Global Conference on Air Pollution and Health. This collaboration has been instrumental in advancing several key initiatives, including the establishment of the National Air Quality Policy, the updating of air quality standards based on WHO guidelines as a legal framework, and the monitoring of impact on reducing mortality due to exposure to air pollution. Furthermore, we are developing our intersectorial national climate plan with a strong emphasis on equity and just transition as a transversal basis. Additionally, several new initiatives will be implemented through partnership and technical cooperation with IPARO and WHO, among other strategic partners. We extend our gratitude to WHO for this dedication to this coalition for clean air. Obrigada, Organização Mundial de Saúde. Thank you very much.
Thank you. Minister Estrada, thank you. I'm going to invite up to our high commitments waiting room the following organizations and countries. Please take a seat. Clean Air Fund, Vietnam, Cuba, the mayor of the city of Mendoza, Argentina, Mauritania, Mongolia, and Mexico. I will never get tired of you cheering, remember that. While we're taking our seats, we're waiting in our high commitments waiting room. Let's hear from Norway and also Germany. Take a look at the screen.
Excellencies, ladies and gentlemen, dear friends. We thank the government of Colombia for hosting the Global Conference on Air Pollution and Health. And we commend the World Health Organization for its leadership and for drawing our attention to the devastating effects of air pollution on health and the planet. We need to find more efficient solutions, and we need to find them fast. Cleaner cities and just inclusive energy transition is part of that solution, as this conference so timely underlines. Air pollution knows no borders, and international coordination is essential. Norway has ratified the UN Convention on Long-Range Transboundary Air Pollution and the EU Directive on Ambient Air Quality and Cleaner Air for Europe. Friends, air pollution damages human health, undermines food security, hinders economic development, contributes to climate change, and degrades our ecosystems. As a nation, we must continue to address these interconnected challenges on the highest political level. We must take collective actions to prevent further harm to our people and to the planet. You can count on Norway's continued support. Thank you.
Excellencies, organizers, ladies and gentlemen, for many decades, WHO has been dedicated to combating air pollution, and with great success. One key accomplishment is the WHO air quality guidelines. They form an essential basis for the further development of our European and national policies for clean air. I would like to express my sincere thanks to the World Health Organization for its important work and pledge our full support, especially in today's challenging times. I'm particularly pleased about the WHO's ambitious target of lowering the number of deaths associated with particulate matter by 50% by 2040 compared to 2015 levels. To meet this target, it will be especially important to continue our push to move away from fossil fuels and provide clean and sustainable energy. In Germany, many measures are helping to improve air quality. These include phasing out the use of coal for power generation and introducing new exhaust emission standards for vehicles in the EU. The EU Ambient Air Quality Directive has also been amended, setting ambitious new limits for air pollutants from 2030 onwards. It paves the way for the gradual alignment with the WHO recommendations. It is also important to continue raising awareness of the dangers of polluted air, particularly of how it affects vulnerable groups like children or the elderly. Air pollution does not stop at national borders. This is the very reason why the WHO's work and today's conference are so important to further strengthen international cooperation. All the best from me in Berlin to everyone in Cartagena. Thank you.
You just heard Minister of Internal Development in Norway and Dr. Christine Rodlatter, State Secretary at the Federal Ministry of the Environment in Germany. We continue our in-person commitments with the Clean Air Fund. Welcome.
Thanks, Femi. So I love that we have this target. Thank you, WHO, for getting us all behind this same target, and thank you, committers, for committing to it. I hope also that we can track how we're doing. I can see that civil society groups are already writing down what they're hearing, and I hope that the WHO will bring us together at the next conference and we'll be able to say this is what we've achieved together. So the Clean Air Fund commits to continuing to work with the WHO on their essential programs to reduce air pollution. We commit to continuing to track the funding to air quality and to push to drive it up, especially in line with this new WHO target. Clean Air Fund spent 110 million in the last 5 years on reducing pollution. And so we commit, we did that already. But what we commit to is spending a further 90 million over the next 2 years. And this funding will support the researchers, the grassroots groups and governments to work together to achieve clean air. Thanks.
Good afternoon, Vietnam.
Good afternoon, distinguished colleagues, air quality and health champion and friends. The Municipal of Vietnam expresses a great appreciation to WHO for strong leadership in organizing this important conference. The Municipal of Vietnam joined the flag of actions for clean air for all and translate into action the knowledge, insights, and innovative ideas taken from this conference. We are committed to take the following action. First, in close collaboration with the Ministry of Agriculture and Environment, take measures to revise the national standard and regulation aligning with WHO air quality standard, air quality guidelines, and upgrade and scale up air quality monitoring system. Second, enhance capacity for health impact assessment and link the air quality data with the health surveillance. Third, further strengthen the multi-sectoral coordination and partnership by putting health at the core of sectoral action. Thank you, WHO. Thank you all.
Cuba, please come to the microphone. Thank you.
Buenas tardes. Good afternoon. Okay, Cuba is committed in this conference to keep what this moment about the environment policy, fundamented in the development plan called Tarea Vida, Life Task, 5 strategic actions, and we are hoping and expecting to have for 2030 a 24% of the energy transition from renewable energy and 100% for 2050. At the same time, we will continue working together with enhancing and improving emissions of the sugarcane plants and facilities, and at the same time the policies related with transport, organic compound, the organizing of all the medium and all health sector with surveillance about the toxic effects on health, on people's health, to be able to obtain that the population in Cuba will have a better life quality. Thank you so much.
City in Argentina. Mendoza City. Thank you. Welcome. No? Mauritania. Mongolia. One second. Does that mean we get twice as much commitments?
За та бүгдэд энэ өдрийн мэндийг хүргье. Би агарын бохирдол эрүүл мэнд гэсэн энэ чуулганд орсондоо маш их баяртай байгаамаа. I am from Mongolia. Би эрүүл мэндийн яамны халдвар тусвчны хэлтсийн дарга хийдэг. За тэгээ миний танилцуулгыг манай энүүжин танилцуулж өгнө.
Hello, good day to everyone. I'm the head of the Department for Non-Communicable Disease Prevention at the Ministry of Health of Mongolia. And I will be reading this statement to help Mongolia make their commitment, but I'd like to clarify that I'm not a government representative myself. So the statement, the commitment. Air quality is a pressing public health concern in Mongolia. The government prioritizes tackling this crisis to protect the health and well-being of our population, in particular children and older adults. The Ministry of Health and the Ministry of Environment and Climate Change of Mongolia wish to express sincere appreciation for the opportunity to participate at the 2nd Global Conference on Air Pollution and Health. We will continue and enhance our efforts to reduce air pollution in the following ways. 1. Embed air quality aspects in the National Action Plan for Non-Communicable Disease Reduction for the period of 2025 to 2028. 2. Renew the national ambient and indoor air quality standards, taking into account the WHO air quality guidelines, and incrementally improve enforcement capacity and expand the monitoring network in the capital city and other settlements. 3. Implement the National Action Plan for Reduction of Air and Environmental Pollution through cross-sectoral coordination. And 4. Incorporate air quality and health into under- and postgraduate curricula of medical training and conduct awareness-raising and training activities for health personnel and the wider community. Thank you.
Thank you. Mexico, you're looking lonely. Come on over.
Muy buenas tardes.
Good afternoon. Well, in Mexico, we have worked as a matter of health and environment to protect health for all of the population. In the case of Semarna, which is the institution I represent, we have signed some commitment. First of all, it has to do with the air quality assessment. We want to promote and drive the air quality monitoring in our country. We want to shift from having an expectancy in 500 inhabitants to those cities where we have 200 citizens to be more protective on health. We are really committed in having quality air index that can be published in periodically, and having early alert systems in high events of pollution that allows us to protect all the citizens when we reach those exacerbate levels of pollutants in the air. In a matter of emission reduction, we have a clear commitment to continue updating all the national regulation from pollutant emissions to limits for industry. There are some sectors, and most of all, some processes that are still missing to be regulated, and we want to have the more restrictive regulations. As vehicles issues, we want moving forward to have better regulations. From this year on, all diesel vehicles need to comply strict regulations to use particles regulation, not only 2.5 but also black carbon. We are also working with a regulation in order to promote and advocate for light vehicles, medium and heavy vehicles. Finally, there's a clear commitment to continue working with different sectors: industry, academia, health sector, economic sector in our country, to continue fostering the reduction of pollutants. And finally, there's a strong commitment to work jointly in order to have a better environmental culture, education in environment, so our children from childhood really know the importance, the environmental health, control of air quality. I thank you all for your attention.
Thank you, Mexico. Please come on stage, India. The mayor of Despinaderos in Argentina. UN Environment, Jacqueline Alvarez. And the Undersecretary Gloria Balbo of the Philippines. Please come and take a seat. You will hear their commitments in just a moment, but first take a look at the screen and let's see what Pakistan is committing.
Greetings from Pakistan and a very warm welcome to all the delegates from across the world present at the second Global Conference on Air Pollution organized by WHO in Cartagena, Colombia. Unfortunately, I could not be there in person, but I would like to share few key messages from Pakistan. Pakistan continues to grapple with air pollution, and some of our major cities are topping the list of most polluted cities in the world. This has forced our local governments and our provinces to ensure lockdowns in some of the major cities of the country. The cities are under lockdown, schools are closed, universities and workplaces are closed, and hospitals are on high alert. Air pollution is a major public health concern. Anecdotal evidence suggests that the average lifespan in Pakistan is reduced by 4 years due to high levels of particulate matter in the air, particularly PM2.5. With AQI dangerously hovering around 1900 to 2000 in some of the major cities of the country. This has prompted the government of Pakistan to take measures to address the seriousness of the situation. As such, we have launched the National Clean Air Policy, which is a document focusing on actions at national scale that can achieve improvements in the air quality across Pakistan. These policies would be implemented at the provincial level by our provincial governments, and the aim of this document is based on the right to life and dignity of man, and it will provide a framework for improving air quality developed through inputs by various stakeholders across the country. Now, through this document, we plan to address some of the key areas which are contributors to air pollution, mainly transport, industry, agriculture, biomass, solid waste, residential and building sectors. Apart from this, air quality is a tragedy of commons and requires regional collaborations and synergies as well as international collaborations to achieve the desired results. I thank you all, and I hope that we can, through our mutual understanding of the issues facing the world, we can come up with some conclusive points to address the issue so that we can make our cities breathe again and make them more habitable for our future generation and protect the health of our vulnerable communities of the society. Thank you all.
Thank you. Undersecretary Gloria Balbao of the Philippines, it is so nice to see you again on the stage. What are you bringing us?
Thank you and good afternoon. Well, cognizant of the severe health impacts of air pollution to the health of Filipinos in terms of additional burden on mortality and morbidity and their economic repercussions, its disproportionate impacts to vulnerable groups, the Philippines is committed to undertaking actions to contribute to the global roadmap on reducing the health impacts of air pollution. We shall link air pollution with our climate change and universal healthcare initiatives to make a more lasting impact on the health and well-being of Filipinos. We will do this through sustained collaboration with key stakeholders, conduct of thorough assessments and studies on health risks of air pollution, use of innovation and technology, and mobilization of resources and finances to implement our initiatives. While we acknowledge that there are gaps to be addressed, we stand confident that with the support of our stakeholders and partners, with the support of the World Health Organization and other partners represented here, we shall be closer to achieving our common goals of clean air as a matter of social justice and as a fundamental human right of all Filipinos now and in the generations to come. Thank you, and we look forward to our continued collaboration.
Thank you. UN Environment. Or the mayor of Despinaderos in Argentina. UN Environment, we're moving on, but if you have a commitment, do come join us. Hello, Mayor.
Muy buenas tardes a todos. En primer lugar,
on the first place, we want to thank Green City and the WHO that small cities can have a voice and we can share experiences on which we are working. But also in such an adverse context that Argentina is living, with a national government that doesn't believe in climate change and was almost to leave of this WHO, we want to say that there are more than 2,000 cities in Argentina working for a climate action committed, and we are those cities that on a daily basis work in our communities in order to make it real. And also within the framework of this commitment, we want to add the Climate Change Network in Argentina, NCCOM, this global agreement for mayors of energy climate, who I represent for Latin America, with more than 733 cities committed to continue this roadmap by the WHO to reduce 50% emissions, but also to put women and children on the center, because the situation on climate change is an important agenda to work together with the center patient and person in center on health. We are convinced that transformations are from local to global. So I motivate you and encourage you to work together as a community with the WHO, with the universities, with the private sector, because this transformation that we are dreaming of is possible. Thank you so much.
Yeah? Come over to the microphone. Thank you.
Good evening, everyone. The Ministry of Environment, Forest and Climate Change India has set a target under its National Clean Air Program 1.0 to reduce the particulate matter level from 2017 baseline to 40% by 2026. Even if this target is delayed, it will likely progress towards 35% by 35, as was talked about in this conference. We, the health sector, would also be supporting in this direction by working towards reduction in baseline prevalence of non-communicable diseases, and our air pollution and NCD surveillance would help in this direction. We would continue to support the better uptake of cleaner energy options for cooking through our health IEC outreach, especially to the vulnerable women population. We would also work with our clinicians to provide choices of personal protection to their patients, especially the vulnerable one, due to existing health conditions. With all these measures, we at India believe that we can make great progress to reduction in health impacts from air pollution by 2040. Thank you.
Thank you very much. Appreciate you. I'm going to ask to come to the stage Breathe Mongolia from the Clean Air Coalition, Center for Disease Control, China, Emerging Leaders for the Clean Air Forum, Environmental Defence Fund, European Lung Foundation, European Respiratory Society, very good. And while you get settled, we're going to have a look at the commitment from the World Meteorological Organization. Take a look at the screen.
Excellencies and distinguished delegates, on behalf of the World Meteorological Organization, it is an honor to address you at this crucial moment in our campaign for cleaner air and healthier communities. I also want to recognize the World Health Organization Director General leadership and commitment to tackling air pollution and its devastating impacts on health and climate. Air pollution remains one of the greatest environmental threats to human health, causing millions of premature deaths each year. No country is immune. Rising temperatures and environmental change exacerbate the risk. Extreme heat, more frequent wildfires, and frequent sand and dust storms are all worsening air pollution. This exposes communities, especially the most vulnerable, to severe health risks, disrupts economic sectors, and harms ecosystems. Protecting human health and saving lives is central to the mission of the World Meteorological Organization. This year, we commemorate 75 years as the United Nations Agency for Weather, Water, and Climate.
That was Celeste Salot from the World Meteorological Organization, the Secretary General of the World Meteorological Organization. Thank you, high-level committers. Let me see. Emerging Leaders for Clean Air Forum. Thank you for committing. We appreciate you.
All right, this time I speak as myself. We, the participants of the Emerging Leaders for Clean Air Forum, a collective of early career researchers, youth advocates, health professionals, climate activists, and educators from across all regions, joined the pledge to commit to decisive action for clean air at the second Global Conference on Air Pollution and Health. The air pollution crisis is also a leadership crisis. As emerging leaders, we have the opportunity to change the landscape of governance and push it toward empathy, equity, and integrity. In this regard, we commit to leading differently, to let the science and facts be the voices of reason, not politics or political interests and economic interests. We commit to break down silos. Cross-sectoral, interdisciplinary coordination is the only way to bring about clean air and a healthy environment for all. We commit to working together and to advocate to change our institutions to foster greater collaboration and creativity. Most importantly, we commit to never staying silent in the face of the injustice of air pollution. We will continue to fight in our diverse spheres of work and experience. We will not give up until we see the day when clean air is no longer a privilege, but a fundamental human right. Thank you.
Thank you so much. The European Lung Foundation. Good afternoon. Your fan club is in the room.
Thanks, everybody. So, inspired by the stories we've heard this week, especially from mothers, parents, and grandparents, the European Lung Foundation commit to continue informing and amplifying the voices of the 2.73 billion people globally living with chronic lung disease and their families, and to empower them to advocate for clean air policies that will directly benefit their health and the health of all our children, and to prevent future lung disease. We will urge politicians not only to listen to these stories, but also to act upon them. We also commit to support the WHO to access and harness the patient voice and support for clean air, ensuring that the WHO's vital work can be supported through storytelling and passionate activism. We also commit to continue to deliver our global awareness campaign, Healthy Lungs for Life, making sure that as many people as possible across the world understand that air pollution is a health issue that affects us all. We will engage with other disease areas to make sure the campaign is as wide-reaching as possible, and we'll deliver it in cities, parliaments, and communities, and wherever it's needed most. Thank you.
Thank you very much. European Respiratory Society, good afternoon.
So the European Respiratory Society wants to thank WHO for this impactful, motivating, inspiring conference. And we want to renew our commitment to air pollution by empowering our 35,000 healthcare professional members to advocate for cleaner air. We heard all through the conference that we have difficult times, we face challenging political times, but one institution that still maintains a certain respect is the medical profession and doctors, and we wish to utilize this to fight for cleaner air. We will continue to support education and research on air pollution and climate change, and we will persist in our efforts to engage policymakers and the public on the urgent need to improve our air quality. Thank you.
Thank you very much. UN Environment, hello. The microphone is yours. You look tired, but the commitment's going to be awesome.
Red.
Go for it.
Oops. I lost my paper.
Okay, I see this. It says $1 billion. Wow, amazing.
It's more than that. It's our commitment. Yes, so air quality, we know, is not a dream. Air quality is really an obligation for all of us. So the United Nations Environment Programme is really committed in a threefold manner. The first one is through outreach and awareness. We are co-founders of the Breathe Life initiative, and we are not only committed to revitalize it, but to connect and to really continue working with all of you on the awareness raising journey that we have in front of us. The second fold of our commitments goes into the global network that our assembly asked us to manage, to create, to consolidate, and that's the spirit of collaboration. It's the moment not only to share, but to act. The launching happened this Monday. Many of you were part of it, and in reality, we need all of you to make it a success. And the third fold that this commitment of ours goes towards is the capacity development. We are engaged, and we are really committed to continue doing that through the platform, the AQMX, that aims in reality to really show the different opportunities and capacities, to be a space for sharing, and also to be that connector that we need. So not a check or $1 billion, but it counts us, if it was.
Thank you.
Thank you.
Climate and Clean Air Coalition, Martina Otto. Martina, are you in the room? Yes, okay, please come and take a seat. Global Alliance on Health and Pollution, please come on the stage if you are in the room. Global Climate and Health Alliance. Take a seat. International Federation of Medical Students Association. Thank you. Mr. Cobra, hello. Please come and take a seat. Pakistan Air Quality Initiative. Are you in the room? Are you here with us? If you are, please come and take a seat. Be good to have you. Ride for Their Lives. Are you here? Yes? Okay, very good. And Santé Publique France. Please come and join me on the stage. It's great. It's good to not be late for commitments. We appreciate that, Sebastian. All right. So while everybody is getting seated and comfortable, I want you to hear from the United Nations Economic Commission for Europe and their commitment. Let's take a look. I give it another 15 seconds, and then we are moving on. All right, we'll come back to that later. They have it? Do you have it?
Excellencies,
Fantastic.
distinguished colleagues, ladies and gentlemen. It is an honor to join you at this critical gathering to address the devastating health impacts of air pollution. UNECE recognizes the interconnected nature of air pollution and health. For over 40 years, the UNECE Convention on Long-Range Transboundary Air Pollution has reduced major pollutants in the region. This framework exemplifies evidence-based policy-making and regional collaboration. The Convention's Task Force on Health under the WHO leadership has uniquely facilitated informed decision. Despite our successes, air pollution continues to impact health systems and economies. Convention parties have therefore set out to redouble efforts under the Gothenburg Protocol to further reduce air pollution. At UNECE, we advocate for an integrated approach linking climate action, sustainable energy, transport and health outcomes in line with the Paris Agreement and Sustainable Development Goals. UNECE co-hosts the Transport, Health and Environmental Pan-European Programme, the PEP, with WHO. This program promotes the integration of environmental and health aspects into transport policies. We also work on standards for cleaner vehicles and fuels. We promote sustainable energy solutions. The health impacts of air pollution demands bold, coordinated and science-driven action across governments, international organizations, civil society and the private sector. UNECE stands ready to provide platforms for countries to exchange best practices, set ambitious targets and align policies for better air quality and human health. Clean air is a fundamental human right. We must ensure that it is also a shared priority. Let this conference unite us in decisive action to combat air pollution, safeguard public health, and build a sustainable future. Thank you.
Thank you. So Mr. Cobra told me earlier, I'm an artist. I speak with my art, but now the artist is going to speak with his words. Thank you. Welcome.
Melhora. Prezados senhores, eu sou artista visual e, portanto, o que mais interessa é aquilo que é visível.
What's most important is what's most visible. And it can be translated and conveyed by people. However, there is an element that runs out of human eyes and that is essential, not only for our present life, but also for future generations and our planet. EUAR. Imagine each of us breathing the air that we feel. 10,000 milliliters of air per day and another, more liters and liters of air that are in constant contact with our bodies, our skin, and our being.
É essencial para
Air that is essential for us to survive. As an artist, concerned for the future of the planet, and as a father, concerned for the future human generations, I want every time more and more to, from my talent, my art, to be able to create awareness to people about the need and the preservation of the environment. And this includes, obviously, to be able to take care of the air that we breathe even better. And that is why that I very proudly received this sense of responsibility and my nomination tonight as an ambassador of this program from the WHO. And I expect to be able to provide my name, reputation, and dedication as an artist to give more visibility to this cause that involves the whole planet, that is a must for the continuity of human life. Thank you very much.
Thank you. Martina Otto. Hello, Martina. Again, nice to see you. Confident, high commitment walk. I like that. Go ahead.
Okay, fantastic. Hello. So I'm here, but it's not one. It's actually representing over 200 partners, so I don't come alone. We're a partnership bringing together governments and NGOs and IGOs, and we apply our 3 key strengths. That's the commitment. We will continue to building political will and work on the advocacy piece, and obviously here Breathe Life is a key component where we will work through. We will continue to bridge across the health, environment, and finance to come up with a common narrative that we can drive the action from all the different angles that we need. We have a clean air flagship that we're going to implement. We work on the economic case, which will bring additional arguments to taking action. So we put our scientific advisory panel to work, and we have a 26 million annual budget. We heard from the UK there was a contribution made earlier today, but that is a trust fund that works at the intersection of climate and clean air for health outcomes. Thank you.
Thank you. Global Alliance on Health and Pollution. Welcome.
Thank you. Good afternoon, everyone. Buenas tardes. I'm honored to represent the Global Alliance on Health and Pollution as Executive Director. Our mission is to support low and middle-income countries, prioritizing their pollution agenda, impacting health outcomes, with air quality always among the top concern, unfortunately. Today, at this conference in Colombia, we reaffirm our commitment to support low and middle-income countries implementing the Health and Pollution Action Plan, which is a multi-stakeholder, country-led initiative that makes pollution a policy priority and creates a roadmap to address major challenges such as air pollution. And I'd like to mention that so far we implemented 13 Health and Pollution Action Plan. We commit to support low and middle-income countries attracting resources to implement the roadmap. We commit to advocate to raise awareness about pollution and air quality issues. Additionally, amongst other programs, in the past 3 years, with the UK aid funding, the Global Alliance on Health and Pollution has been working in Vietnam with local partners to reduce the harmful agricultural practices of open burning. By researching and promoting sustainable, profitable alternatives to open burning, we help lower carbon emission while improving health and environmental outcomes and creating economic value. Our model is replicable, but open burning remains a challenge. So we commit to continue and possibly expand this effort, and we welcome collaboration. Please stay in touch. Thank you.
Thank you. Global Climate and Health Alliance, welcome.
We're at the last day. Well, the second to last day. For those who don't know, the Global Climate and Health Alliance is an alliance of over 200 health organizations from around the world that come together to bring a joint health voice to bring health into the climate conversation, drive more ambitious climate action, and deliver a healthier future for everyone. As we've seen this week, health professionals can be powerful champions for clean air and climate action. Collectively, GCHA's member and partner organizations represent over 46 million health professionals globally. GCH applauds WHO for your ongoing leadership on addressing the health impacts of climate change and of air pollution and the root causes. So our commitment. We commit to working in collaboration with all of you, the partners and allies here at this conference, to advocate for a healthy, just, and equitable phase-out of fossil fuels and a full transition to clean, renewable energy for all. And we commit to advocate for embedding clean air and health considerations into local, national, and international climate policies, including this year into the nationally determined contributions under the Paris Agreement.
Thank you. We have about maybe 18 more minutes of high-level commitments to go. If you can make it that long and stay in the auditorium, we are all going to be in a big family picture. All of us in the auditorium, on the stage, in the picture. I'd love you to be in it. Stay with us for just a little bit longer. It will be worth it. International Federation of Medical Students Association. What are you committing? What?
Good afternoon. First of all, thank you, WHO. Thank you, Government of Colombia, for organizing this really important but also needed event. The International Federation of Medical Students Associations is the world's largest student-led health organization, representing over 1.5 million medical students, over 123 countries. As the air pollution and the climate crisis escalate, the FMSA calls on all the stakeholders to match the urgency of health science with the courage of political change. This is not something new for the FMSA, as we have been advocating for clean air for more than 35 years, and we will continue to lead with purpose and action. So, the FMSA remains committed to advocating for the full integration of air pollution and planetary health into medical curricula, clinical guidelines, and national health systems. Developing tools to equip medical students with the skills to engage effectively with policymakers and bridge the gap between academia, clinical practice, and policymaking in advancing clean air solutions. Building the capacity of future healthcare professionals worldwide to understand and address the health impacts of air pollution through education, research, and advocacy. Promoting WHO air quality guidelines and air pollution training toolkit to ensure that healthcare workers are equipped with the knowledge and tools to address air pollution as a public health emergency. And finally, standing in solidarity with all the stakeholders, because we are not alone, fighting for clean air, ensuring no voice is left unheard in this essential struggle. We reaffirm our commitment to planetary health, intergenerational equity, and a future where clean air is a guaranteed right, and no one dies from the air that we breathe. Thank you.
Thank you very much. Santé Publique France. Good to see you on stage again.
You lost this paper.
Thank you. Thank you very much.
Ago. I do it in French, or are you ready?
What's most powerful? What gets more commitments?
Ok, on y va. Alors, merci beaucoup à WHO et au gouvernement de Colombie pour avoir organisé cette magnifique conférence avec des panels.
Thank you for the government of Colombia for organizing this conference. I represent a public health institution to obtain those ambitious goals. We have a responsibility. We join data and collect epidemiological evidence. For those decision makers will say that sometimes the action is short, but how can we, as a representative, as an institution, that concerns about these matters is to guarantee that resources and priorities of air pollution will be addressed for the future, and the work that we've been doing for 30 years in cooperation with WHO and supporting on the methods of quantitative assessment, guaranteeing that these challenges will be engaged in global challenges, because we know the planet is facing global challenges that are linked to the problems of atmospheric pollution. We are in this climate change, all the issues about chemical pollution and the loss of biodiversity are those challenges that we want to engage in our actions in terms of air pollution controls. For this, multidisciplinary control is essential, and we are professionals of public health, so we need to work with specialists of environment that have this data and that understand the methodology about the pollution issues, and with whom we could not have any successful and accurate solutions. Also to be open to disciplines of human sciences, social sciences, and sociologists, economists to estimate costs, and action about these costs will be transformed in costs for action, and working with specialists of public policies, because we want to convince these public policies about the need of acting. We also commit to reinforce our action in advocacy in the center part of public health. Public health agency has to be trained to accelerate energy transition and the intersectoral opportunities. Thank you so much.
I didn't know what I was signing up for when you said email. Hello, I represent, my name is Mark Hayden, I represent Ride for Their Lives. We're a tiny group of insanely enthusiastic individuals that just feel anybody can solve problems by getting together on bikes and helping each other, fixing a puncture, sharing cake, and the like. I think what we commit to do is to continue to deliver the messages of the experts like the World Health Organization and our relative royal colleges, to engage healthcare clinicians, frontline healthcare clinicians, in actually speaking truth to their patients where it's appropriate and helping them to live healthier lives. And we would be happy to help at zero carbon and zero pollution emissions anybody in the room who would like to use the mechanism of cycling together and helping each other to maintain the hope, which is very, very hard to do even after some of the very ambitious commitments that we've heard from huge countries like China and most excitingly Mongolia. Thank you.
Thank you. We have one last batch of live commitments on the stage. I'm hoping they're still in the auditorium. Solar Cookers International. Are you here? Yes. Come onto the stage. The Gambia Permian Health Lung Institute. You still here? Urban Better. Yes, are we still here? Urban Better? All right. If you hear your organization, please come to the stage. The World Organization of Family Doctors. Fantastic. Look at the stamina of our final live committers. And from Mexalu, Yanef Lopez. Thank you. I'm going to get you all time to come onto the stage, get situated. And while you do that, we're going to look at the commitment from UN ESCAP. Take a look at the screen.
Ladies and gentlemen, it is my pleasure to address this global conference aimed at tackling air pollution and health. I congratulate the WHO and the government of Colombia for holding such an important gathering. The interlinked priorities of air pollution and health are felt very acutely in the Asia-Pacific region. Contaminants in indoor and outdoor air contribute to increased frequency of birth defects, cardiovascular disease, and early mortality. The greatest risks are posed to children, the elderly, and pregnant women. Air pollution is a silent killer that results in nearly 116 deaths per 100,000 people in our region. More than 1.1 billion people are exposed to indoor air pollution from cooking and polluting fuels and technologies. In 2019, an estimated 2.4 million people in the region died prematurely from illnesses associated with the use of solid fuels and kerosene for cooking. When we consider the joint effects of indoor and ambient air pollution, that figures approaches 4.9 million. Across the region, and particularly in major cities, nearly all people experience air quality far below the WHO recommended guidelines. Many locations have experienced a deterioration in air quality from both local and remote sources, but great strides have been made by countries in highlighting the risk and providing information to citizens. At the same time, there are solutions such as renewable energy generation, electric mobility, improved agricultural practices, and clean cooking that address the multiple objectives of widening energy access, stemming air pollution, as well as climate change mitigation. In our region and around the world, clean cooking technologies are gaining hold, including electric cook stoves that ensure clean air as well as delivering energy and emissions saving benefits. ESCAP has supported countries such as Bhutan, Lao PDR, and Nepal in deploying and adapting these technologies to local environments. The ESCAP Regional Action Program on Air Pollution is a framework to enhance air quality management. It facilitates the exchange of information and updates on clean air cooperation, identifying key areas for collaboration, and recommending actions to strengthen stakeholder contribution. We support our member states by developing guidance on ambient air quality legislation to assist policymakers in establishing effective standards. And furthermore, regional cooperation is fostered through platforms like the Asia-Pacific Clean Air Partnership, focusing on knowledge sharing, capacity building, and joint research projects to improve air quality. And in closing, I wish you all success in your deliberation and reiterate our standing as a firm partner in our collective efforts to tackle air pollution and climate change. Thank you very much.
Somalia has been inspired by the commitment so far and wants to join us on stage. Thank you, Somalia. I love that. All right, look at this. Still energy back here. Still awake and still ready to commit. We appreciate you. Solar Cookers International. Hello.
Hello, thank you. Buenas tardes. The mission of Solar Cookers International is to improve human health, economic well-being, women's empowerment, and the environment by promoting climate-friendly solar cooking for vulnerable populations worldwide. In alignment with the science-backed World Health Organization guidelines and resources, Solar Cookers International is committed to accelerating integration and implementation of solar cooking, reducing air pollution from combustible cooking fuels, increasing household cooking energy independence and security, expanding multilateral initiatives and collaborations, sharing and/or encouraging use of resources for advocacy and awareness, economic impact, open source design plans, product testing according to standards by the International Organization for Standardization, best practices such as local production, data collection, and involving local women solar cooking champions in initiatives, primarily for training and follow-up. Muchas gracias.
The Gambia Permian Health Lung Institute.
Thank you very much to the World Health Organization and the Government of Colombia for organizing this. I speak here in my capacity as a founder of the Lung Institute in the Gambia, and we're going to make 3 commitments. We commit that we will continue to maintain and keep the data from the National Ambient Air Quality Network in the Gambia fully open and transparent, and we'll continue to support the government of the Gambia to measure air quality on a continuing basis. We believe that open data is critical to foster collaboration to address the complex issue of air pollution. Number 2, we commit that we're going to continue to be fierce advocates for the patients in the communities we serve, to give them a seat at the table and a voice in the conversations that has to be had around air quality monitoring and also air pollution. We will continue also to train healthcare professionals in the Gambia to connect the dots between air pollution and health so that the practice catches up with the science. Finally, we're also going to continue to advocate and support the National Environment Agency and the Ministry of Health to ensure that we establish an ambient national standard based on the WHO guidelines in the Gambia.
Thank you. Are you going to commit again? Because if not, you can exit the stage here. You committed a lot already. Thank you. Always ready for more. I appreciate you, Doctor. Urban Better.
Hello, everyone. I love the energy. I'm here as founder of Urban Better, and we're a not-for-profit committed to accelerating healthy, sustainable urban development worldwide. Our core our mission is asking, what if health was at the center and the central guiding principle of all urban development? And really critically, as the fastest growing urbanizing continent and the youngest continent, what if Africa led the way, and youth in particular, in shaping cities for cleaner air and healthy public spaces? And so our precision advocacy citizens are as a youth-led movement using physical activity and citizen science, equipping and connecting a youth-led movement using to increase the demand for clean air and healthy places and cities, and to enhance meaningful participation of youth in decision-making to shape the today and the future of our cities. So our commitment is building that participatory infrastructure and supporting cities. We work hand in hand with partners in cities, hosting citizens' hubs to build the capacity of youth to use the data to generate their own evidence, to drive advocacy and to drive decision-making towards healthier cities. So our specific commitment is in the next year having 10 hubs, 10 cities across the world doing that, and we're hoping Bogota and maybe Cartagena will join us on this, and having 30 cities. We're hoping to get 100,000 citizens over the next decade, really mobilized, using data, really democratizing the knowledge generation to increase the demand for clean air and really accelerating our efforts to make the urban better, one breath at a time. Thank you.
Thank you very much. Thank you. World Organization of Family Doctors, good to have you making a commitment. Thank you.
Thank you. Thank you. I was hoping I'd be the last person so I could give a shout out to the WHO team, but we love you. You're such a great team. Thank you. I'm Alan Abelson, sometimes known as Dr. Smog, representing the World Organization of Family Doctors. we represent 500,000 family doctors caring for 90% of the global population. The family doctors and other primary healthcare practitioners play an important role in this movement for clean, healthy air because of the public trust that is afforded to us and our teams. We spend most of our time in consultation with patients, so time to assess and treat is short, but our byline is 1 minute for the planet. Our intervention today is focused on training the healthcare workforce. At the first conference in Geneva, we pledged to train 40 healthcare workers in lower middle income countries. We did better than that. We trained 70. They then went out and trained others, went into schools, and got involved in policy. Today, we commit to training more than 100 primary care healthcare practitioners about air pollution and health, utilizing the WHO toolkit for healthcare workers, so that these healthcare practitioners can be better clinicians to their patients, better advocates for clean, healthy air in their communities, and train other teams of primary healthcare practitioners. Thank you.
Thank you so much. Mexalu Yanev Yoples. Hello. Are you available? Are you coming? Mexalu? No? Thank you.
Bien, gracias por la oportunidad de estar aquí.
Thanks for the opportunity of being here in behalf of all the authorities in the healthcare sector of Mexico. I am very grateful for the invitation and the whole team in WHO and PAHO to be here. And we reiterate right after these very hard-working 3 days our commitment in the healthcare sector in Mexico to join the whole global call. We reiterate strategies addressed the strengthening in the governance and leading of healthcare and environmental issues, along with the activation of the working team for climate change and environmental health to intersectorally and extrasectorally address the strategies and specific actions in the mitigation and reduction for negative effects in healthcare due to climate change and air pollution and environmental pollution, in this particular with air pollution, with the focus of one single health. Would also strengthen the essential tasks of public health to address this huge problem that we have been able to see during these 3 days by the strengthening of epidemiological and health surveillance in terms of environmental health, to monitor the environmental threats and exposures and the risks of health and the effects that we are having in the country, thus consolidating this system of epidemiological surveillance and damages to health because of air components, water components, and soils, among others. Thus generating the fostering of research and further knowledge in the setting of environmental healthcare through the whole medical staff in the healthcare sector, also by formulating policies and the implementation of legislation that can protect the population in terms of environmental health, promoting the communication of advocacy against the risk. Also through the strengthening of the monitoring, warning, and the preparation for answer on these emergencies by activating early warnings. Also generating the evidence of damages against health for environmental contamination through this team, together with the academia, which will be coordinated, linking research lines in tight collaboration with the social academic sectors and the healthcare sector that are interested in participating in this research, that are focusing on healthcare damages due to environmental contamination and finding strategies for its improvement. Thus, from the government of Mexico, from the healthcare department, we joined this great call.
Somalia.
Somalia.
It is so good to have you.
Thank you.
What are you committing?
First, let me take this opportunity to thank World Health Organization and the government of Colombia and their people for hosting us and And taking this also on behalf of Minister of Health of Somalia, and communicated with the Minister of Health, this is what we are going to commit. In line with Somalia's National Transformation Plan 2025 to 2029, the federal government of Somalia commits to reduce reliance on diesel and fossil fuel to use for energy source of healthcare facilities. By achieving that by 2029, 50% of the all healthcare facilities. And also, the minister will promote to work collaboratively with other organizations to reduce that 75% Somali household to transition to clean cooking solutions. Thank you so much.
Thank you so much. We are 5 minutes away from the wildest photograph you have taken all year. Be ready for that. We are going to unleash our high-level commitment energy. But first, I want you to take a look at a video from the UNDP, from the administrator, Akim Shiner. You may have seen it as you were walking in, but we wanted to make sure that it really registered. Have a look, and then Dr. Maria will be right up here in this space, and Heather to close us off. Thank you. I do love these moments. The minute I start telling you something deeply significant is the minute that Akim Steiner is going to pop up. That is always the way. But I want to thank you for your energy, your excitement, your commitments as well. We really appreciate it. Are we going to get Akim Steiner? Let's play him out at the end. Dr. Maria.
Director General, my dear friend and colleague.
You knew it was going to happen. Thank you, Akim.
Ladies and gentlemen. The air we breathe should sustain life, not threaten it. Yet air pollution claims more than 7 million lives annually, with 9 out of 10 of these premature deaths occurring in low and middle income countries. It is an issue inextricably linked to development. As part of the United Nations family, the United Nations Development Programme is committed to supporting development pathways that tackle air pollution and advance global efforts towards healthier and more sustainable futures for all. Central to our efforts is our support to over 140 countries to, for example, advance climate pledges that drastically reduce emissions through our Climate Promise initiative. This includes working to integrate action on air pollution and black carbon into nationally determined contributions supported by the Clean Air Fund. We are also tackling the issue at the household level. Clean cooking solutions are improving poor air quality, particularly benefiting women and children. For example, in Angola, our Solar Kitchen initiative provides clean energy to hundreds of families, boosting both food security and income generation, a very simple and powerful illustration of how progress can be made. Equally, the energy transition is central to our work. Since 2022, UNDP has advanced nearly 400 clean energy-related projects in 128 countries worldwide, directly targeting nearly 80 million people. For instance, if we look to Zimbabwe, where 60% of health facilities now run on solar power, ensuring uninterrupted energy access that is essential for delivering life-saving services while significantly reducing diesel emissions, thanks to the support from the Global Fund and UNDP. Innovation is also a key facet of our support. In India, the UNDP Accelerator Lab used geospatial data and artificial intelligence to map nearly 50,000 air-polluting brick kilns. This effort, in turn, improved monitoring and enforcement, with nearly 4,000 brick kilns transitioning to greener solutions. As part of our pledge to assist 100 countries advance the right to a clean, healthy and sustainable environment by the year 2030, UNDP recognizes that air pollution spans multiple sectors and ministries, but often lacks clear ownership. Therefore, we are fostering systems approaches and advancing innovative partnerships such as with our Common Air. With support from the European Union, we have also begun to develop an air pollution toolkit, which has been piloted in countries from Ethiopia and Mongolia to support new integrated action on pollution, health and development. Dear colleagues, clean air is a human right, a universal need and a shared responsibility. This objective, which lies at the heart of the global goals, requires us to rely on the World Health Organization's critical role in setting robust health standards, driving meaningful change, and fostering global cooperation needed. Just as air connects us all, so too must our collective determination to protect it, for today and for the many generations to come. Thank you.
Very much, Achim. Ladies and gentlemen, it's the end of a very long day, and I'm sure you are all very tired. Before the concluding ceremony, let me tell you something. There is a film that is projected or will be projected in a few minutes, organized by Moms for Clean Air and Clean Air for Our Kids. I think it's important. If you still have energy, or even if you don't have energy, just to watch it, I think it will be very good. Can I invite all the WHO staff to join me on the stage, please? Come on. And when I say WHO, of course, I mean OPS as well, and other colleagues. Join. Before I forget, we are supposed to make commitments, and we have a very long list of commitments from WHO. But because we recognize that it's time to be very pragmatic, I will summarize on one thing. Yes, we commit. Is that okay? Yes. So we commit personally, one by one, and we commit as an organization. Be reassured that WHO is not giving up at all. I want, of course, to thank the government of Colombia for hosting us, and again, Cartagena for allowing us to be in this magic place. And I have a long list of organizations that I want to thank, but I will refer to them on the back of your program. So instead of me reading it, again, to be very pragmatic, just to read it, please. There will be a photo family, but before that, I need to thank very, very much this amazing team, the Green. You have no idea what it takes to organize something like this, but of course all the energy, the results, the success of what's happened here the last 3-4 days is just because of you, because you have been contributing, because you have responded to our call, because you allow us to do the most beautiful role of WHO, which is the convening. And this is about convening. So you have been convened, you are responding to the convening call, and now you are nominated as special ambassadors for this fantastic role of clean air for all of us. Thank you one by one. I think you know all of them. I don't want to name them. They are the best ever team in the world. Some of them are horribly shy, but they are very competent. Come on, guys. Anyway, so again, thank you so much. Don't relax your commitment, your fantasy, your engagement, the passion, because It's all about leadership, as it was mentioned this morning by the Deputy Mayor of London. Leadership matters, and I am convinced that the 700 people meeting here in Cartagena was definitely, each of you are an amazing leader. Thank you very, very much. You want to say anything, guys? Heather? Yeah.
I'd like to say thanks, yes, to this amazing, amazing team. You have no idea. When things get rough, they're all there. Those pollution pods, they weren't working. We all came out within 5 minutes. They ran out, and we were all lifting late night to the pollution pods. We're a very, very small team, and this is what we got. And a very, very thank you. But we're just a part of the huger, larger, more bigger community, because we are all working together to make this clean air happen. And I really thank you all for your time and commitment. And we're very lucky that we get to be in such a part of a big community. So thanks to you all.
So now, please, everybody on the stage, because we are having this famous family picture. Come on. Bravo, chicos. Bravo, bravísimo. And of course, a big, big, big applause to the most amazing facilitator ever. Please, come on, come in. Has been amazing.
So the photographer said, "What time are you doing the photograph?" And I said, "In 2 minutes' time." Where is he? ¿Dónde está? Where is the photographer? Okay, so where's the photographer? Okay, what do you need for the photograph? What do you need? Everybody come on stage. This stage is big enough. We can all fit. It's going to be very exciting. A big picture. We need to do this quite quickly unless we want to be in the movie that's about to be shown. Is everybody down in the picture? Should we go traditional, smaller people in the front, taller people at the back? We can try that. It's fine, it's kind of working. I'm feeling everybody's aura in this picture. I might not see their face, but I'm feeling their aura.
You need to come out from behind the big tall guys there so we can see it.
Are we in it? You are not in this picture. You need to be closer to the front. All right, everybody in. Okay, very good. Clean air.
Clean air.
Healthy air. We're not going to stop until we win.
Hello, I'm in the back, and we just took a picture. Vamos a anunciar porque la gente se va a ir. Vale. Yeah, can you announce, because the other day there was a problem, yes, and everybody left, so it's a second chance, you know?
I have one more. I have one more. I have one more. I have one more. I have.
Yeah,
I kind of feel like I'm ready to go.
I try.
Okay, everybody, I've got one last thing to ask you to do.